Hello, everyone. Thank you for joining us today for our virtual Open Enrollment Fair session. During today's session, we will go over UnitedHealthcare benefits. Before we get started, I would like to brief everyone on a couple housekeeping items. All attendees are muted and will remain muted throughout the presentation. If you have a question, please type it in the Q&A box located on the bottom of your monitor. All questions will be answered at the end of the presentation. Be informed that if you type a question in the Q&A box, everyone attending the session will not see your question nor your name. If you have a delicate, sensitive question, please contact the Benefits Division directly. Lastly, today's webinar is being recorded. A copy will be posted on the Benefits Open Enrollment website. At this time, I will turn it over to our presenter, Nick Cruz.
Good afternoon, everybody. Thank you so much for allowing us to be here. My name is Matt Ogden, and I work for California Schools VEBA, and I'm your dedicated account manager for the county. And today we're going to go over your open enrollment benefits for UnitedHealthcare as well as UMR. And then we're going to talk a little bit about the additional resources through VEBA. So let's go ahead and get started. On today's agenda, we're going to go ahead and start with Nick Cruz, who's going to be presenting on behalf of UHC, and then we'll turn it over to Margie Gorham, who's the account manager for UMR. And then again, like I said, I'll talk about the additional benefits, and then we'll wrap up with any questions that you may have. So with that being said, let's go ahead and dive right into it. Nick, it is all yours to talk about UnitedHealthcare products.
Perfect. Thank you, Matt, and hello, everyone. Thank you for having me today. My name is Nick Cruz, and I am a field account manager with UnitedHealthcare. And I have the pleasure of helping you better understand the benefits available to you as a member of the County of San Diego. All right. So just like in years past, the county will continue to offer the Performance HMO Network 1 plan. A few key benefit changes that we want to call out here for 2023 are the urgent care copays and the virtual visits. So you will now have one flat copay when it comes to the urgent care visits. And that copay will be at $25. In the past, you had an increased copay when visiting out-of-area urgent cares, which will no longer be the case. As well, for the virtual visit copay, there will be a change where you will now have a $0 copay for all virtual visits that you have. All other copays will remain the same. For instance, the PCP visits will remain at $25, as well as the specialist visits. The hospital copay will be the $200 copay per admit, and the emergency room copay remains at $125. So on the right there, you'll also see a snapshot of all of the medical groups that are currently offered under the Performance HMO Network. So one key thing that I want to call out is a name change for Cassidy Medical Group. They will now be under the Optum Care Network. So you'll see the Optum Care Network at the top, North County, San Diego, Encinitas, and the Optum Care Network, North County, San Diego. So those are just two name changes that occurred to medical groups. It's not that one disappeared or Cassidy Medical Group is no longer offered. It was just a name change that they're now under Optum. Next slide. Perfect. So here we have, so here for the 2023, all county employees currently enrolled on the PHMO Network 2 plan. You will need to select a new plan and PCP in 2023. The great news is there's virtually no disruption if members choose to elect the CS Viba Alliance HMO plan. Now, in a combined effort, we continuously work with Viba to provide accessibility, affordability, and quality in all of the plan offerings to members. So as a result, improvements were made to the Viba Alliance network to include medical groups from PHMO2, providing additional medical groups choices and lowering copays to members. So that's part of the change that occurred and why Network 2 is going away. Again, if you want to remain with those same medical groups that are available under PHMO2, you can see here on the network comparison, all four of the San Diego-based medical groups that were in PHMO2 are also in Alliance. as well as there's 4 additional medical groups in the Primary Care Associates, Scripps Clinic, Scripps Coastal, and UCSD that are a part of Alliance, giving you more access and available medical groups under the Alliance network. Next slide. All right, so here we have a snapshot of the Alliance network that we just kind of touched on, and the benefits for the Alliance plan. The same benefit changes that we discussed for the PHMO1 network for urgent care and virtual visit copays will apply to the Alliance as well. So again, you'll have that one flat copay when it comes to urgent care visits. That will be the $25. And then again, for the virtual visits, you will not have that $0 copay moving forward in 2023. Again, if you go through the copays on the left there, all of the other copays remain the same under the Alliance network. You'll still have a $25 PCP copay. Specialists will remain at the $40 copay. The hospital copay is a $200 per admit, and the ER copay remains at $125 as well. And on the right, again, there's just a snapshot of all the available medical groups that we saw on the previous slide. So just again, you see the Greater Tri-Cities, Scripps Care Affiliate and Mercy Physicians, the Optum Care Network, Radies, Scripps, Scripps Clinic, Scripps Coastal, Scripps Physicians, and UCSD. All of the available medical groups under Alliance in the San Diego area. Next slide. All right, so new in 2023, the county will now be offering the Harmony Network with a high deductible health plan. So this plan will be HSA compatible, and it will have combined medical and RX accumulators. And to clarify, combined accumulators basically means that RX copays and the Express Scripts copays will be included in the medical deductible and out-of-pocket limits for the medical plan. So any copays that you pay through Express Scripts will be included in the medical plan. They're combined. There will be 2 versions of this plan. The first version will be for individuals only, and they're enrolling on the plan with no dependents. The individual only plan will have a $2,700 deductible, and you can see the breakdown on the left that I'm kind of going through. It will have a $2,700 deductible and a $3,000 out-of-pocket limit. The family plan, which will apply to any member enrolling with 1 or more dependents, will have a $3,000 deductible, and the family plan will also have a $3,000 individual and $6,000 family out-of-pocket limit. As you can see from the grid there, the benefits will have a 10% copayment after the deductible is met as the payment structure for each and every service, which means the member will be responsible to pay in full, pay the deductible in full, or excuse me, pay in full until they satisfy their respective plan deductible. Once the deductible is met, you will only be responsible for 10% of the allowed charges per service. On the right, you'll also see a list of the available medical groups under the Harmony Network, which includes SHARP, UCSD, and the Optum Care Network facilities. Again, just to call out that those were previously named the Primary Care Associates Medical Group, and they're now under the Optum Care Network. So that was just a name change. It's not that they were removed. All right. So here we have some of the HMO reminders and requirements for members. So members must choose a PCP from any participating medical group in the plan network they select. Plan selections are required at the time of enrollment and are locked in once they're made. Family members are able to select different medical groups within the same network they select. As an example, let's say a subscriber elects UCSD, a spouse can also elect Scripps Clinic because both of the medical groups are available under the Alliance network. So you're not required to have the same medical group. Medical group changes within a member's plan network are allowed. Again, this is following the UHC guidelines for PCP and primary medical group changes, though, when those changes are made. UHC also supports and allows qualifying event changes within each of the distinct networks. Next slide. All right, so on each of the networks that we went through, I kind of touched on all of the benefits. Here we see is simply a snapshot of the cost by plan. It's a side-by-side, co-payment comparison for each of the plans we discussed, and to help you better understand the differences in copays. So for instance, just looking at PCPs, you can see into the Performance HMO Network 1 and Viva Alliance, both of the copayments are $25, and under Harmony, it would be a 10% copayment after the deductible. So it just gives you a little bit of side-by-side, so that way you can understand the differences, again, when making your decision or making your choice. All right. So jumping right in here, we have our custom UHC and County of San Diego dedicated member website. So for those of you who are unfamiliar with it or haven't utilized it in the past, the link is up at the top. It's that yuhc.com/COSD. I do highly recommend using this site. It has a lot of great resources. There's no username, email, or password required to enter the site, and it is available for existing members and potential members that are just reviewing options. Now on the site, you can view your plan options, you can find a provider, hospitals, urgent cares, ERs, and also view a variety of wellness benefits available to our members. The site also provides access to a provider search tool. It's broken down by each of the individual networks, as well as in-network behavioral health providers. Now, one thing I do want to call out with the County of San Diego website, it is currently under maintenance. It should be completed here relatively soon. So some of those changes aren't reflecting as of yet, unfortunately, just due to timing, but we are in a hurry to get those updated, and they will be done as soon as possible. Just wanted to make sure if you go out there and you're looking, for instance, for the Harmony plan information, it's not currently showing, but it should be there within the next few days. So here we have, again, we talked about the provider search section. So the provider search tool is made easy here, where you simply select the network that you're looking at finding a provider for. There's banners on the banner on the left. Will have each individual network, and it's a quick shot to the provider search tool. Again, you're sent directly to the provider directory once you select the network, where you can enter in your address or a zip code and the area that you're looking for a specific PCP, and you'll gain access to all of the available network providers in that area. Now, granted, if you're looking for a very specific provider in that area, you can always put in their name or even narrow it down by medical group, depending on what you're specifically looking for. And that option is there as well. Next slide. Perfect. All right, so here we have a picture of the UHC Member ID Card. So ID cards provide all of the information necessary when seeking medical services. They have things such as your member ID and your group numbers, and it will have your assigned PCP, as well as the primary medical group that PCP is under. So the cards will also have the general copays, and also any applicable deductibles and out-of-pocket maximums will be listed. Now, just as a reminder, anytime there is a change to any of the information listed on your ID card, a new one will be generated and sent out within 7 to 10 business days of the change. So you also want to be sure to throw out that old card to avoid any confusion when seeking services and any information changes, such as a PCP. Granted, the card will still work to locate you as a member, but it may cause confusion if you had a change in PCP. So, again, make sure you throw out that old ID card. Excellent. Perfect. So on the back of the ID card, it also houses all of the general contact points members can utilize for assistance. So it also includes that dedicated customer service number. It's 888-586-6365. Good number to always have on hand in case you have any questions or concerns that you need assistance with. There's also that mental health support number and provider support numbers that come in handy when needed. You'll also find the claims address. So for any reason you need to mail in a claim or submit a claim form, that address is listed right there at the bottom of the ID card. So that way you know where to send it to for the claim to be processed. Perfect. So next we have the Myuhc.com portal. So this is the UnitedHealthcare member portal. On this site, you can view claims, bills, referral status. You can change your PCP. You can search our network for providers. This is also where members access the Raleigh portal, virtual visits, temporary ID cards, spending account information, and much more. So if you are a UHC member and you have not registered on the site, all you need to do is have your insurance card handy and go to the myuhc.com to register and create a profile. There is also a MyUHC app. It's available and you can download it directly from your phone and log in to access all of the amazing functions and resources available on the member portal. So all of the same functions are available all through the app. One key thing I want to point out is that the digital ID cards are available through the myuhc.com app. And they are available within 48 hours of a change being processed. So if a member calls in for a PCP change, the digital ID card will be available with that updated PCP information within 48 hours. So that way you don't have to wait around to receive the hard card in the mail. You can simply go to the app and have a digital version of it on your phone. So that way you can seek services as soon as possible. Thank you. So here we have the exciting OnePass membership program. So OnePass is a subscription-based fitness network of gyms and studios that equalizes wellness opportunities for people and employers. So the great thing about OnePass is it offers freedom of choice between the 4-tier options available. So on your screen, you'll see that there's the Total Fitness, Universal Premium, and Ultra Fitness tiers available. Each tier ranges in price, beginning at $25 a month, all the way to the most expensive one, which is $139 a month, all of which have a $0 enrollment fee. Each tier offers multi-location access where members have the freedom to change locations at any time, and the ability to access all of the amenities, services, and classes each gym offers. So again, it's really built on freedom of choice. If you were to run out of classes at one gym within a given tier, there's all additional classes at a different gym within the same tier. And it's a great program, a lot of great feedback from members on this taking advantage. All right, so here we have Peloton. So the Peloton digital membership is a 1-year digital membership free to all UnitedHealthcare members. Again, this is available to employees and each covered family member underneath the plan. You are not required to have a Peloton bike or any of the Peloton devices. You simply can log in to the Peloton app anywhere, anytime. And you simply log in via your cell phone, tablet, any Apple device, Roku, anything where the app is available. And they have classes and lengths from 5 to 60 minutes. And again, no equipment is necessary. The classes are very extensive and really touch the needs of any and all. So I highly recommend taking advantage of this. And again, it's 100% free. All right. So just like Apple Fitness, just like Peloton, UnitedHealthcare has added the Apple Fitness app as well to its wellness offerings. And this is basically to help engage fitness, right into members' homes. Apple Fitness is one of the most popular fitness programs on the market, and UnitedHealthcare plans to include a 1-year Apple Fitness subscription as well to members. Now, the only difference with this one compared to Peloton is that you will be required to have an Apple device in order to take advantage of this particular program. It is a $79 value per member and each of the covered family members. The subscription can be shared with 5 family members. The program, again, it also serves as a companion to our Raleigh Health and Fitness program, which we'll talk about in just a few minutes. So it's interactive and they go hand in hand together. And it helps members achieve the goals through Raleigh in order to receive the Raleigh coins that we'll talk about. So it's a great program. Again, I highly suggest members to take advantage of moving forward. All right. So here's Raleigh. Again, Raleigh is a digital wellness experience. It's offered through the myuhc.com website that we talked about earlier. It's designed to help you make healthy changes to your daily routine and set smart goals and track progress. So Raleigh has what we call a life survey questionnaire. It's designed to take basically a holistic approach to health and wellness by inquiring about things like sleep and your diet, alcohol consumption, social interactions, exercise to accurately, determine what we call a Raleigh age. Now, Raleigh makes health and wellness approachable by giving you appropriate goals and lifestyle recommendations based on your current routines and habits and behavioral patterns, so that you are more likely to stay committed and motivated to achieve the goals long term. Now, as a reward for your hard work in achieving those goals, Raleigh awards you with Raleigh coins. And this is basically for taking healthy action, which you can redeem for gift cards and various discounts. You can also use it to enter into a Raleigh sweepstakes for much bigger prizes. So Raleigh also offers the ability to connect with the community of people, embark on group challenges, and receive all the support you need through your health journey. So it's again a great program that I encourage people to take advantage of. And as mentioned, it works hand in hand with Apple Fitness, where any classes you take can be applied towards your goals on the Raleigh program. All right. So here we have, again, what I like to call the best thing since sliced bread and virtual visits, where members can, you can skip the lines and the wait times of going to the doctor's office or urgent cares, and you can access care from a mobile device or a computer 24/7. There's no appointment needed. We have 4 contracted groups in network for you to choose from, and that's the Optum Virtual Care, Amwell, Doctors on Demand, and Teledoc. So virtual visits are, they're great for treating things like, rashes and pink eye and sinus infections, flus, bronchitis, and again, the list keeps growing that they can assist with under a virtual visit. All you need is your health insurance card ready when you sign up. And we do strongly recommend and encourage members to take advantage of virtual visit options. And again, as part of your benefits, and if you recall, there's that $0 cost now on your plans for the virtual visits. So highly recommend members to take advantage of this and avoid those waits at the doctor's offices when necessary. So continuing with virtual care, we also offer behavioral health virtual visits. And this is basically, virtual therapy offered through confidential counseling with private one-on-one sessions. It's designed to help treat conditions like addiction and anxiety, depression, ADD, ADHD, and other similar mental health disorders that members may have. So we highly encourage you to take advantage of that as well. Works the same exact way as virtual visits. Providers are different, but the available use in virtual visits, directly from a home phone or device is also there and helps you skip waits, as necessary. All right. So here we have the Sanvelo Meditation and Mindfulness app. So this app was created by psychologists, and it's a top-rated self-help app that uses clinically validated techniques such as cognitive behavioral therapy, or CBT. It's a type of psychotherapy shown to be especially effective for individuals experiencing, high levels of stress or symptoms of anxiety and depression. Again, this is an app available to you from the convenience of your phone, and it empowers individuals to engage with activities to help improve your mental health, anytime, anywhere. It helps relieve, symptoms and build life skills that may reduce potential high-cost interventions in the future. So it offers daily mood tracking. There's coping tools and guided journeys. On the site with personalized progress, which is, great, as well as community support. So again, this is members with access to Sanvelo through their benefits can use the app at no charge, regardless of whether or not they have a behavioral health diagnosis. So a great tool. I highly recommend utilizing this as well. All right, chiropractic and acupuncture care. So this coverage will continue to be offered to members via the Optum Health Network. In-network providers can be found on it's a long one here, My Optum Health Physical Health of California, or of CA.com website. So if you're not familiar with that one, I know it's a bit of a long one, but again, it's My Optum Health Physical Health of CA.com. And that's where you can look up all of the in-network providers for chiropractic and acupuncture care. So when you do go to that website, you simply, on the left from the list, you'll simply want to select Provider Locator. And up at the top, once you select that, there's a specialty listed, and you'll just want to select either Doctor of Chiropractic or Licensed Acupuncturist, depending on which one you're looking for a provider. The plan product is California Schools Viba. And once you enter in that information, you simply hit submit. There's no additional filters needed in order to get a list of the available providers, unless, of course, you're looking for something, a specific provider. If you're looking for a specific provider, you can always enter in their information. But otherwise, I recommend simply leaving it open so that way it gives you all of the available options and doesn't limit you. Perfect. So just as a reminder, UHC is always here to help. We have dedicated teams standing by, waiting to help with any questions or issues our members have. And of course, that's starting with the before mentioned dedicated VEBA member customer service line. That's that 888-586-6365 phone number. It's available on your ID cards, just as a reminder, but if you want to take that down, that's there too. So they're always there and available to help. For behavioral health customer service, the phone number again there is that 888-625-4809, available for any of your behavioral health needs as well, or any questions you may have. Of course, the County of San Diego member website, that's the yuhc.com/COSD. And then, of course, the UHC member site, the myuhc.com. So all of those are wonderful tools, just in case you have any questions or follow-ups or anything that comes up throughout the year. They are your best tools to get those answers or get the answers to the questions you may have. All right, well, thank you everyone for your time. I appreciate it, and I will go ahead and pass it on to Margie Gorham to go over the UMR benefits.
Thank you, Nick. Good afternoon, everybody. My name is Margie Gorham, and I am the UMR Dedicated Account Manager, and I will be presenting some of the tools and resources available to you with your UMR PPO medical plan. So working with UMR, we are a third-party benefits administrator that will assist you in managing your health benefit plan on behalf of California Schools Viva for the County of San Diego. So with UMR, your benefits give you access to the United Health Select Plus network, in which we will discuss in the next few slides. I will also talk about your PPO plan benefit coverage, how to select your provider, and other resources that will give you the tools in getting the most out of your plan. As your benefits administrator, we are here to assist you with your health claims administration, making sure that they are handled quickly and accurately. Also, if you're dealing with any chronic medical condition or if you're in a hospital, we have medical professionals on staff that will help coordinate the care that is helpful and beneficial, especially at a crucial time of need. Next slide, please. So you do have access to a PPO network through UMR. The PPO network are providers that are contracted with UnitedHealthcare. They are a group of doctors, hospitals, and other healthcare providers who offer network discounts on the services they provide. A great benefit to you if you go to an in-network provider is cost savings. So when you receive care from an in-network provider, the plan pays typically a bigger share of the cost, and you'll pay less out of pocket. Another benefit is your ability to self-refer to providers. This is a freedom of choice with a PPO plan. So if you are enrolled in the PPO plan, you have the flexibility to switch to a different primary care physician anytime, or you can see a specialist without a referral. This could be dermatologists, gynecologists, infectious disease doctors, and many others. You are free to visit any provider you choose. Your preventive services are covered at 100% by the plan, so there's zero cost for you. We do highly recommend going to an in-network provider, especially if you're going for your preventive services, because if you go to an out-of-network provider, your services are not covered at 100%. The reason for that is that our in-network providers are held to a contract and out-of-network providers are not, and they can charge you what they see fit. Next slide, please. So a new change this year for your plan, you're only offered one PPO medical benefit. I know last year there was a high deductible health plan that was offered, and this year it's only one PPO medical benefits. So your PPO medical benefits are as follows. You do have a deductible. You have to first meet your deductible before you pay any copay or coinsurance. So for an individual, your deductible is $300. And your family deductible is $600. Please note there is an out-of-network coverage with your PPO plan. So for an out-of-network deductible, that's $600 for an individual, and for a family, that's $1,200. The most that you will pay out of pocket for in-network, an individual plan, is $2,300, and for a family, that's $4,600. And for an out-of-network provider, out-of-pocket maximum is $4,600 for an individual coverage and $9,200 for family coverage. Your coinsurance for medical expenses, the plan pays 80% and your coinsurance is 20%. Currently, your primary care physician visit is $20 copay per visit for an in-network provider. And for an out-of-network, that will be 40% coinsurance, and the plan pays 60%. For specialists, your copayment will be $40 per visit, and the plan pays 60% for an out-of-network provider. Keep in mind that your pharmacy vendor is with Express Scripts, and with Express Scripts, your copay for a generic prescription is $10. For a preferred prescription, that's $20. And for non-preferred prescriptions, that is $35. Next slide. Okay, there you go. So for the PPO plan, your inpatient hospitalization, you have a $150 copay per admission for an in-network provider. Once you have met your deductible, the plan pays 80%. And for an out-of-network provider for inpatient hospitalization, that's $300 copay per admission, and the plan pays 60% after the deductible. Your urgent care visit will be $75 copay per visit for in-network provider, and for emergency room care, that is $125 copay per visit for in-network and out-of-network providers. Therapy services is your occupational, physical, speech therapy. There's a $20 copay per visit. There is an unlimited visits for the year. However, after 30 visits, it will be reviewed for medical necessity. Your preventive care, as I mentioned earlier, these are your screenings, immunizations. It will be covered at 100%. So you have a $0 copay per visit, and deductible is waived. And also you do have virtual visit through Teledoc vendor, and your copay is $0. Next slide. So it's important to remember that you will have access to the UMR.com website after you have been enrolled. After you receive your member ID card, make UMR.com your first stop. You'll find everything you want to know and need as soon as you log in. So with access to the UMR website, you can see your benefits information anytime, whether on the desktop or on your smartphone device. So from the My Menu tab, you can check your benefits, highlights of your plan, co-payment, co-insurance for you and your dependents. You can also see the amount of your office visit. You can get a review, your deductible and out-of-pocket amounts, and if you're close to reaching it. The website also gives you access to your explanation of benefits and view all of your medical claims. So this is the fastest and easiest way to check the status of your claims. You can also learn about medical conditions and treatment options in the website. A few things to remember to help you through the registration process. Make sure you have your UMR member ID card handy. You will need your member ID number and the group number to enroll. Dependent spouses must create their own online account by selecting I am the spouse or dependent when they register. You will need to provide a valid email address and make sure you select a username and password you can remember for when you log in again in the future. Next slide. So please note that access privileges apply to both UMR and our mobile websites. So adult age 18 members and over need to grant access to their information in order for the plan holder to see their claims and benefit details. So that means if your spouse are logging in, you would have to ask privileges for you to see their account as well. Next slide. So also when you are in the UMR.com website, you will have access to the online provider directory. After you've become a member, to quickly find the care you need, simply select Find a Provider in the Provider Network tab. Look for the Provider Network UnitedHealthcare Select Plus and start your search. Another way to look up a provider is by selecting that Find a Provider icon, and it will give you an option for a more specific search. So as a UMR member, you have the ability to search also mental and behavioral health providers, including counseling and substance abuse. You need to select a behavioral health tile tab. This link will direct you to our Live and Work Well provider website, or you can also call our UMR toll-free number at 800-826-9781. This number will be also listed in your ID card. They can assist you if you're having trouble finding a provider online, or if you're checking if the provider is in the UnitedHealthcare Select Plus network, or if you're having a hard time just navigating the site. Our customer first representative are happy to help you in finding any in-network provider. Next slide. So as you navigate through the provider search online directory, you can also look up care where you live or work. You can search specific to a city, state, or distance by zip code. This tool also very helpful when you search providers by category, such as specialty type, doctors, other healthcare providers, hospitals, clinics, urgent cares, and imaging centers. You can also look for laboratory and imaging to get your screenings and lab test scans. You can also search by services and treatment and care by condition. So some great things to look out for when searching for providers is with our UnitedHealthcare premium symbols. These are the heart icons that you'll see next to a provider listing. So as you can see, 2 dark blue hearts rating are our premium care physicians. You will save the most money when seeing these providers, and we highly encourage that you see these providers whenever possible. Our premium care physicians are providers that have met our program criteria for quality and cost-efficient care. The next rating is the 1 dark blue heart and 1 white heart provider. This is a quality care physician that has met the program criteria and for providing quality care. The next rating is with the 2 white hearts, and these are providers that the quality for service has not been evaluated. And it also means the specialty is not evaluated or the evaluation is in progress. The 2 light gray hearts rating are providers that does not meet quality care. So UnitedHealthcare reviews and rate healthcare providers in the network for how well they deliver quality and cost-effective care. They're also rated by the feedback from our members. So whenever you see the premium care and quality care physician, you will save the most money and get the most quality in care provided. So it's very important that when you choose your physician to look out for this symbol whenever possible. So another great feature is our treatment cost calculator tool. I know this tool can help you estimate your potential out-of-pocket cost for a treatment or procedure. You can predict your cost based on the plan you are enrolled in, the PPO plan. So with the health cost estimator, you can search for a treatment or procedure options in your area. You can compare the cost based on the medical facilities you visit and view a range of costs based on your medical plan. So this tool is very beneficial for you to plan for how much out-of-pocket it will cost for a certain treatment or visit at a particular provider. And it's definitely one that you need to check once you become a member and have access to the website. Next, please. So with the health cost estimator tool, you can also search for treatments, procedures from local providers. You can view estimates, including your out-of-pocket costs and what your medical plan will pay. You can also choose a provider and get a final estimate. I know this is very important once you're looking into certain costs for treatments. So as you can see in the slide, you need to look for the health cost estimator icon to get to the treatment cost calculator. And this is such a great benefit as a UMR member to have a projected cost for certain treatments or surgeries so you can plan accordingly. So choosing a primary care provider is not mandatory for a PPO plan. However, we do highly encourage that you choose a primary care physician. A primary care provider, or PCP, is a doctor you go to for most of your general healthcare needs. So when you have an established relationship with a PCP, there is a continuity of care with routine checkups like health screenings, immunizations. They can help manage your preventive care. You can also address any health concerns that you have. So your primary care physician is aware of your overall health and can address them quickly. They can also help manage your prescription medications. So when you also have an established relationship with your primary care doctor, you can ask advice, information, healthy behaviors, treatment options, and self-care. So even if the plan doesn't require the PCP's referral to a specialist, it's always a great idea to check with your primary care physician, and they can also recommend a specialist for you. So there are certain services that require prior authorization. These are put in place to make sure they are medically necessary services. So if you or a dependent plan to be admitted to the hospital or receive certain outpatient services, UMR may receive prior authorization. Your provider may be asked to provide information to confirm the service or inpatient stay is medically necessary or clinically appropriate and considered effective for treating your condition. Services that need prior authorization may include hospitalizations. This is with the exception of emergency services, inpatient surgeries, behavioral health stays, home health care, durable medical equipment. An example of these are their CPAP machines, a back brace, or wheelchairs. Radiology services such as MRI, PET, and CT scans, your chemotherapy and radiation, dialysis, transplant and transplant-related services, cosmetic procedures, and clinical trials. So as I said, these are in place to safeguard that you're getting the treatment that is absolutely necessary and medically needed. Another benefit to you is our dedicated nurse line. A call to UMR nurse line service will connect you to a team of registered nurses who can answer your questions and provide advice. Our nurses are standing by to help any time of day, 7 days a week. We even have nurses available to chat live with you online at umr.com. And best of all, is part of your health benefits, and so there's no cost to you. They can answer your questions like what preventive screening do you need, how long, how you can learn about new diagnosis, or would an over-the-counter medication help? Should I go to the emergency room? So this is extremely helpful if you find yourself up late with a sick child or worrying about a recent diagnosis or upcoming surgery. You can just dial in and call the nurse line service. The phone number is listed up there, and this is also listed in your ID card. Also, translation is available for non-English speakers. So as I said earlier, you do have telehealth through a Teledoc vendor. The visit to this is $0, so this is free for you. So with that Teledoc, you can talk to a doctor anytime, anywhere. You can receive quality care by a Teledoc healthcare doctor by connecting by phone, a video, or mobile app. You'll be assisted in 10 minutes on average, and network doctors can treat every member of the family, have prescriptions sent to the pharmacy of your choice. You can also really pay less than going to the ER or urgent care clinic by a call to Teledoc. So some of the health issues that you can get consultations are cold, flu. Well, next slide, please, Matt. Cold, flu, allergies, strains or sprains, digestive issues, sinus problems, pediatric care. You also have specialty care for dermatology and behavioral health therapy. So to access Teledoc, you need to create your own profile through the teledoc.com website and register with your UMR ID member number, or you can also call the 800 Teledoc phone number that's listed on the screen. So if you are a new member or have switched from UnitedHealthcare to UMR or from another carrier, you will receive a new member ID card. This is what your member ID card will look like. On the front of your ID card, you will find your member ID number assigned specifically to you to track all of your benefits and claims information, a list of the family members covered under your plan, your medical provider network, also referred to as your preferred provider organization, your PPO plan. Going to doctors, clinics, and hospital in your network will save you money. So you can see there, it says UnitedHealthcare Select Plus Network. The number assigned to identify your group, that group number is 764144102. That is the actual group number. Information about your prescription drug plan. As you can see, you'll see Express Scripts in the front of your ID card. Next slide. On the back of your card, you will find the in-network and out-of-network deductible and out-of-pocket maximum amounts. You can also see your UMR Care Management phone number to call when your plan requires prior authorization for certain medical services. If you're traveling outside your network coverage area, you can look to see if you have access to a regional or secondary network. The toll-free phone number to call when you have questions about pharmacy benefits, and the phone numbers to call for UMR customer service and the nurse line. So we don't have an app, but we do have a mobile website. All of the tools you see today is available in your smartphone. With umr.com, you can log in and pull a digital copy of your member ID card on your mobile device. So you'll find all the same information as what appears on your card. So I just want to let everybody know that we will have an upcoming app that will be live to all members effective January 1st, 2023. I know there is a push for it to be available in December for this year, so we're hoping that will come sooner. So what happens after you receive care? Anytime you're one of your dependents, see a doctor, visit the emergency room, or admitted to the hospital, the healthcare provider or facility will submit a claim to UMR for processing based upon the information shown on your member ID card. UMR then determines how the claim will be paid based upon the rules outlined by your benefits plan. Next slide. So anytime you or one of your dependents see a doctor, visit the emergency room, or admitted to the hospital, the healthcare provider will submit the claim and UMR will be processing them. UMR then determines how the claim will be paid. So once you visit your provider, this is a diagram of how claims are processed by UMR. UMR will typically process your claim within 30 days of receiving it from your provider. We may contact you or ask for additional information to complete your claim. So if you have any questions regarding your claims or explanation of benefits that you're not seeing the UMR website, you can call the UMR phone number listed in your ID card, and we'll be happy to answer any questions you have regarding your claims. Next slide. So after you receive any services from a provider, you will be receiving a bill or an explanation of benefits in the mail. So, and you will see the amount your bill may depend on different things. These are the type of care you receive, co-payment amount or co-insurance level of service, amount of money previously applied to your deductible, contracted discount for an in-network care, out-of-pocket maximum amounts for your benefits. So it's important to review your EOB, explanation of benefits, whenever you receive them. So after UMR has processed your claim, you will receive an explanation of benefits. As I said earlier, the EOB is a statement. An EOB is not a bill, but it will tell you how much the service costs, how much of the cost will be paid by your plan, and how much you owe, if anything, and what special codes mean. So have an EOB to match the bill that you receive from your provider. Whenever you call customer service, it's very important to review and check those amounts. Next slide, please. So understanding your medical explanation of benefits, this is what your EOB looks like. This is simply a statement explaining your benefits activity. It includes the services provided, amount billed, and amount paid. You can always call customer service on your ID card or visit theumr.com if you have any questions about your explanation of benefits. Next slide. So utilizing the UMR.com website gives you access to your EOB and view all your claims. This is the fastest and easiest way to check the status of your claims. So as you can see, that's what it would look like on the website. They have the dates of service as well, and the family members that are listed under your plan. You can also search their claims when you have the access. Next slide. Another great feature is your ability to check your benefits and highlights of your plan, co-payment, co-insurance for you and your dependents. So you can see the amount of your visit. You can also review your deductible and out-of-pocket amounts, and if you are close to reaching it. Next slide. Another feature in our website is our chat online. This is a 24/7 customer first representative service. So if you don't have a chance to call on the phone, I know this is very helpful to just quickly send a chat and get your questions answered right away. Next slide. So please note that UMR may contact you and ask whether medical care you receive was related to an accident, and we do process claims appropriately on your behalf. So we may contact you and ask for additional details related to accidents resulting in an injury. So for any questions related to accidents, you can also visit the website and select the accident details icon, or you can call the phone numbers listed there. It's 888-291-3774. Next. So as we mentioned earlier, UMR can assist in support coordination of care. So we do have nurse case managers if you've been recently diagnosed with complex conditions such as chemotherapy, cancer, or major surgeries. UMR nurse case managers serves as advocates for patients and their caregivers during medical events involving multiple healthcare providers and procedures over an extended period. Our UMR nurse case managers can support you by reviewing your treatment needs with your doctor. They can help you and your family understand your benefit options from diagnosis to conclusion. They can help coordinate your care among different providers and communicate any complex issues to your medical plan. Next slide. So we do look forward to helping you, and if you have any questions, you can always log in and visit our website at umr.com. It's fast and convenient way to get information and access services and resources provided with your benefit plan, and you can always call us at 800-826-9781. And I appreciate everyone and letting me share, and now I'm passing it back to Matt.
Thank you so much. Really appreciate all the great information provided by both Nick for UnitedHealthcare as well as Margie. My name again is Matt Ogden. I am your dedicated account manager through California Schools Viva. And basically, whether you're enrolled into the UnitedHealthcare plan or the UMR plans, that are being offered, this automatically means that you're a VEBA member. And being a VEBA member has a lot of additional benefits that are available to you that I'm going to go over here in the next few slides. So new to the county this year, we are now offering Carrum Health surgery benefit to anybody who's actually enrolled into the UMR PPO plan. And Carrum Health is a concierge benefit that's available for anybody who is planning on hospitalization for any of the following procedures. And they include spinal procedures, orthopedic procedures, coronary artery bypass graft, also known as CABG, and then bariatric procedures. And so really what Carrum does is they have taken a look at folks who have gone ahead and had these surgeries in the past. They're looking at the different hospitals that are in the area. They're looking for who are the best surgeons for these type of procedures, where are we going to get the lowest readmission rates, who has the best nurses on site to help with these, and then what are the best treatment options available, the medical equipment that they use to treat these types of surgeries, and they evaluate and rate them all. And so if you are enrolled into the PPO plan and you are planning to have hospitalization for any of these procedures, you can contact Carrum Health. And if you decide to go with any of their recommendations that they have, then they're going to go ahead and take care of the cost in full. So they're going to waive your copays, their co-insurance, any deductibles that are tied to it as well. They're also going to assist you with if you need transportation to the specific hospital that you're about to have, or transportation, meals, lodging, etc. We understand that those costs can add up quite nice, or can be quite plentiful. So basically what they will do is they will cover the costs at 100%. Again, this is for members who are enrolled into the PPO plan offering only. And you can see a list of the different hospitals that they have partnered with for any of these type of surgery benefit procedures. Now with Carrum, they will walk you through step-by-step all the way on these procedures. And so they have a mobile app. You can speak with the physician that you're currently working with. They can guide you step-by-step all the way, helping you with the claim costs, everything that you need to get this procedure taken care of. And so I have provided their information, so you can always visit them at carrum.ma/CSViba. You can call them at the 800 number. They do have an app that's available. They're absolutely fantastic. They will walk you through step by step. I do want to make mention though, is if you do contact them and you decide, you know what, I don't really want to use them. I want to have my surgery with the doctor that I'm currently accessing care with. That's what I feel comfortable. We want to let you know that that is perfectly fine. That is okay. You would just be responsible for whatever the normal out-of-pocket cost that the plan provides for that particular surgery benefit. So new to the county this year, we are excited. And once again, it is available at no cost to the members. And it is for anyone who is enrolled into the UMR PPO plan. Now, whether you're enrolled into the UnitedHealthcare HMO plans or the UMR PPO plan, we do want to let you know that there's a lot of additional resources that are available to you. And they include the Viba Advocacy Department, as well as on-site member services. Through on-site member services, we want to let you know that that's where a lot of our well-being information is. We're going to talk a little bit about the Viba Resource Center. And then you always have access to free flu shots at no cost for you and your covered dependents. And then finally, we're going to talk about Teledoc Medical Experts, which is a second opinion program. So we're going to touch base on each one of these here one by one. So let's go ahead. We're going to start off with Teledoc Medical Experts. And Teledoc Medical Experts used to be formerly known as Best Doctors. So if you've ever worked with Best Doctors before, it's basically the same exact service. It's just transferred over to Teledoc. And what it is it's really a second opinion program. Second opinion program. You know, maybe you have to undergo a aggressive surgery, or maybe you've been diagnosed with a chronic condition and you want to get that second opinion before you undergo any treatment options, then you can always contact Best Doctors. And I've provided their number shown on the right here at the 800 number, or you can visit teledoc.com/medical experts. And really what they're here is to give you that second peace of mind. So, you know, if you have to go in for that aggressive surgery and you're thinking, you know, hey, what other options are available to me, or is this something that I absolutely have to do, you can always reach out to Teledoc medical experts. And what they're going to do is, with your permission, they're going to have access to your medical records that you decide that you want to share with them. So if you've been having communication with your doctor about a particular surgery, let's just say, for instance, like a knee surgery, then they can get access to your MRIs, they can get access to your x-rays, your lab work, any prescriptions that you've been on. And what they're going to do is they're going to take that information, they're going to bring it up and to one of the world-renowned doctors that they have. They have over 50,000 world-renowned doctors, and they're going to find an area in the expertise of whatever it is that you're going through. So if you're having knee surgery, then it could be a knee doctor. And then what they're going to do is they're going to look and see if you're getting that right diagnosis, that right prognosis. The treatment options they can make recommendations for is the surgery that you're about to have. Is it an outdated surgery? Or maybe you don't need to have surgery. Maybe it's something that you can do through physical therapy. So they'll look and see and give you that right diagnosis, prognosis, and then those treatment option recommendations. So whatever it is that you do decide to do moving forward, you'll know that you feel confident making that right decision. I want to make mention this is available to you and your covered dependents. There is no cost to this program, and you can utilize it as needed. The next service that I would like to talk to you about is our VEBA Advocacy Department. This is actually one of my favorite departments that I work with pretty much on a daily basis, and they're here to advocate for you, the member. You know, we understand that there's a lot of times when you're trying to contact either your doctor's office or the medical group or even the carriers, you know, you may not be getting the answers to the questions that you need right then and there. And so the Advocacy Department is here to advocate for you. And they are available to you Monday through Friday, so 5 days a week, and they are available from 8 a.m. to 5 p.m. They can help you with anything from, you know, getting that referral from a primary care physician, or maybe you're transitioning to a new provider, or you're having problems with access to care or the quality of care that you're receiving. There's so many different reasons why you can call them. And so I have provided their information below at the 800 number, as well as their email address. And one example that I always like to use that I've seen firsthand with them is I've actually had members who have been standing in line at the pharmacy trying to get their prescription. For whatever reason, they're not finding their prescription information. And so the cost of the prescription is coming up as a retail cost, as opposed to whatever the flat copay that the member should be paying. Well, the member was able to contact the Advocacy Department. The Advocacy Department was able to pull up the member's information, provide it to the pharmacy on their behalf, and then the member was able to get that prescription at the appropriate copay instead of paying the retail cost. So that's just one example of many that I've seen that have come through firsthand, but they are really a great resource. So in this next slide, I just want to show and demonstrate, you know, when you would want to go ahead and contact the carrier versus when you would want to go ahead and contact the Advocacy Department. And I'd like to start over to the right-hand side. Is you would want to start and contact your carrier if you need to order a new ID card, or maybe you're looking to change your primary care physician, if you're trying to find an in-network provider, or maybe you've received a bill, you're not exactly sure why. You have questions about what that out-of-pocket cost should be at that time of service that you had, or if you have general questions about your coverage. Now, when you want to speak to the Advocacy Department is, you know, if you've received that bill, you're not getting anywhere with the carrier and you're not sure why you have this bill, you thought it was covered, then you can always contact the Advocacy Department. They can always look into it a little bit further. If you're having any troublesome experiences with your doctor or your insurance carrier, you know, maybe you're trying to get that referral that's being pushed through, it's just not getting pushed through, they can assist you with that. Or if you have any questions, again, like I mentioned, about any kind of prescriptions after you've contacted your pharmacy benefit manager. Again, I have provided their information. They're a great resource. You can speak to them live. All conversations are 100% confidential, and this resource is available to you at no cost. Now, also being a VEBA member, you have access to the VEBA Resource Center. The Viva Resource Center, really what it is it's a brick and mortar building that we opened up back in, I want to say 2019. And really what it was designed to do was help treat the individual with whatever well-being challenges that they have, whether it's physical, whether it's mental, whether it's emotional or social and more. They really want to work with you, the individual, on helping you achieve your overall well-being goals. So back in 2019, we did open up a brick and mortar building in Mission Valley for folks to be able to come in and seek the services that they would like. But then what we did was, with COVID, then we had to shut down that building. Well, we are excited to announce that we did open up a second building last year, and this is off Ruffin Road. So it's really literally about 1 block away from where the county has one of their main offices. And so if you are interested in accessing the Viva Resource Center, then I'm going to provide you with some information here in the next coming slides about how all the offerings that it has to do with. So really what we offer here at the Viva Resource Center, we offer movement classes, stress management, cooking, nutrition, and professional development. With our movement classes, we have like stretching exercises, different types of exercises for all different skill levels. We've had Zumba classes in the past. We've even had Zumbini for kids, which is really cute. And we've had access to all different types of movement classes for all different kind of skill levels, whether you're a beginner for a first time or whether you considered a professional athlete. We have all different types of equipment that we can have. We have Stairmasters, we have the crunch balls that you can do your ab crunches with. I mean, there's basically a full gym that's available to you in there. And then we have all different types of classes that you can take part in as well. With stress management, we have things like acupuncture, we have meditation classes, we have different types of yoga classes and meditation sessions. Our most popular are healthy cooking demos prepared by our own chef, Leslie. Not only does she do healthy cooking demos in person, but we have a plethora of cooking demonstrations that we've hosted virtual events for as well. She is absolutely fantastic. She can somehow make broccoli taste like bacon. So you definitely want to check out some of our healthy cooking demos whenever you get a chance. And then we also have professional and personal development as well, things like financial classes, different types of coaching classes as well. So at the Viva Resource Center, like I mentioned, we do have a brick and mortar building that's available on Ruffin Road. It is open and available to you. I will go over how you can go ahead and access the Resource Center, but we want to let you know that, since the pandemic, we understood that it wasn't easy for folks to be able to access the Viva Resource Center in person. So we provided a lot of our content virtually. We now have over 200 classes each and every month, and there's such a wide variety of topics. Like I mentioned, there's yoga classes, fitness classes, healthy cooking demos. And basically we record all these presentations. You and your friends and family can take part in as many of these classes that are available online right from the comfort of your own home. You can even share them with your neighbors, your coworkers, friends that you like, friends that you don't like. So really you can share this with anyone that you would like to. When you are accessing the Viva Resource Center, you do need to be a Viva member. We will work with you on whatever well-being challenges that you are as an individual. We do realize, healthcare is not just a one-size-fits-all. What meets the demands for one individual is not necessarily going to meet the demands for another individual. So we really want to work with you individually on achieving those well-being goals. If your group is ever interested in maybe taking a tour of the Viva Resource Center, or you'd like to host an event, you can always reach out to me, your dedicated account manager, or through the Viva Resource Center. We're more than happy to host any live events that you would like to have. And also at the county, we want to let you know that we're always willing and committed to being able to bring the resources out to you. So if you have, a wellness program where you would like for us to come out to your site, do any kind of, maybe it's a healthy cooking demo or meditation or stress classes or anything like that, we're happy to bring those resources out to the county as well. So for the individual members' resources, like I mentioned, we're here to help you achieve your overall well-being goals. And, any challenges that you have, again, whether it's physical, mental, emotional, social, we have the resources and we provide more of a holistic approach to being able to help each individual achieve those well-being goals. And so with the individual resources, again, as I mentioned, we do have a lot of classes that are available either virtually or in person. You can get one-on-one support, which I'll talk about here in the next slide. We can, again, host any kind of events, as well as we have a lot of resources that are available online. If you happen to miss any of our classes that we have, we do have a YouTube channel that has archive of all the different classes that we've gone ahead and filmed in the past that you can take a look at, that you can take part in right from the comfort of your own home at your convenience. And then if you ever have any questions, again, I did list here the Advocacy Department. They are here to help with any kind of complicated questions that you may have and resolve any issues that you might need. Now, being a VEBA member, you do have access to our Care Navigator through the VEBA Resource Center. And really what they are is they are a nurse practitioner that's willing to work with you one-on-one to help you with those well-being challenges that you're going back. They use more of a holistic approach. So they're not here to prescribe medications, but really what they are is work with you as an individual on achieving those well-being goals. So if you do want that one-on-one support, being a VEBA member, you do have access to that service. Now with the VEBA Resource Center, you do have access to all these resources. There is no cost that is involved to this. So again, whether you're enrolled into the UnitedHealthcare plan or the United or the UMR PPO plan, then you do have access to these resources for you and your covered dependents. If you want to keep up to date with the VEBA Resource Center, we do highly recommend going ahead to vibaresourcecenter.com/newsletter and signing up for our newsletter. Really what this will do is it will keep you up to date with any events that we're having, anything that you can take part in. You can go ahead through here is also sign up for any of those virtual classes that I had mentioned. If you're interested in coming in person, then it talks about how you can go ahead and sign up to go ahead and take a look and schedule an appointment with one of our care navigators and tour the VRC as well. So really the most up-to-date content is going to be through our VEBA Resource Center. Finally, I just want to go ahead and conclude the presentation, just providing you with our contact support and resources. So we just want to let you know, again, my name is Matt Ogden. I am your dedicated account manager for the County of San Diego. I have provided my contact slide, so feel free to reach out to me anytime. Also is Heather Simonson, who is our VEBA ombudsman, and she's here to help and support in any way possible as well. With that being said, that does conclude our presentation today. We want to go ahead and thank each and every one of you for joining the call today. We are going to go ahead and open it up for live Q&A. So we do see that you have gone ahead and submitted a lot of questions through the Q&A. So I'll go ahead and read off those questions. And then we'll have the appropriate account manager go ahead and make answer each and every one of those questions. If you come up with any additional questions, please feel free to put them into the chat. We will stay on as long as needed to make sure that all of your questions are being answered. So with that being said, let's go ahead and move right in. Nick, this first question is actually going to be for you. So we did receive a question with regards to the new Alliance plan. You mentioned that for hospitalization, there's a $200 copay if you need to access the hospital. They're wondering if that is per visit or if that's going to be if it's going to be per day, $200 per day, or if it's going to be for the entire hospital stay.
Yep, so that's going to be per admit. So basically per visit. It's not going to be per day, it's per admit into the hospital. Okay,
perfect, great. Thank you for answering that. And then we have another question. This could be for both Margie and Nick. Is the deductible part of the out-of-pocket maximum?
Yes, yes it is.
It's also yes for the PPO plan.
Okay. So I always like to think about when it comes to plans that have deductibles tied to them, then the way that I've always liked to describe it is the member is responsible for any services rendered 100% of the cost up until they reach that deductible, whatever that deductible amount may be. Then after they've reached that deductible, then they're only responsible for paying a portion of that cost. So that could be 20% or 10%, depending on the plan or what the plan covers. And the insurance provider will pay the remaining amount. Once you've hit that out-of-pocket maximum, that's what we like to call your uncle card. Basically, you're not responsible for paying anything at that point on. The plan will go ahead and pay the rest of the amount. I hope that helps answer that question. Let's see, for the high deductible Harmony Health, or for the high deductible Harmony plan, the new plan that's being available, it says outpatient services, say 10% after the deductible. Where can we find the fixed cost for office visits, x-rays, etc. Once we hit the annual deductible? Trying to weigh the cost of a $25 visit on one plan versus a 10% deductible on the high deductible plan. So Nick, maybe you can help kind of discuss it. It looks like the member is currently on a Kaiser plan, which is going to be a fixed copay amount versus what the deductible would pay at that time of service.
Yeah, so you kind of covered it a little bit a second ago when talking about the deductible. Until that deductible is met, the member would be responsible for 100% of services until the deductible is met. Now, if they're wanting to know how much services will be, unfortunately, that's not something we can predict. Or there's not a set amount for each and every services that we can provide. So it's not a question we can fully provide an answer to. Now, again, after that deductible is met, they're only responsible for 10%. So to give an example, if for some reason, if the service is $200, the member would be responsible for 10% of that $200 once they meet the deductible. If they have not met the deductible yet, they would be responsible for the full $200 for said service. So that should help it a little bit, but in order to provide a list for each service, unfortunately, we cannot provide that. There is I will say there is, however, a cost estimator on the myuhc.com website, the member portal. But again, it's not 100%, but it will help with those costs if you're trying to get an understanding.
Okay. Nick, that was greatly answered. Thank you so much. Do you have another question for you here? And is there no comparable option for the current high deductible where we can go out of network? Actually, Margie, this one might be a little bit more, you know what? This might be for you, Nick, because I think we're still discussing the high deductible plan. So is there no current high deductible, like if they were to seek services out of network?
Yeah, so I mean, it honestly kind of applies to both. If they're looking for an option with the high deductible plan where there is out-of-network coverage, UMR would be the option as an additional plan. When it comes to the Harmony high deductible plan specifically, they would need to seek services within the given network. There's not out-of-network coverage on that. So it's a little bit of a two-part.
Yeah, so if we are talking about the UnitedHealthcare high deductible health plan, then you must seek services in network. You cannot go out of network for services. If you do, you're responsible for 100% of those costs and would not be covered under the plan. Now, under the UMR plan, then if you go to and seek services out of network, then you may be responsible for paying a higher co-insurance for that. Is that correct, Margie?
Yes, that's correct. And for this year, we are not offering the high deductible plan like last year. So it is the PPO out of network that they will be utilizing, which is the plan pays 60% for an out of network services.
Wonderful. Thank you, Margie. Nick, we have another question here for you. So for the Peloton and Apple Fitness, that is 1 year long, that is 1 year only, or is there a recurring fee that you have to pay if you stay on UnitedHealthcare for each year?
So it's 1 year only from the time a member signs up. So it's only 1 year that is available to them. there is, if you would like to keep the benefit as you move forward, that it would be directly through Peloton and Apple Fitness. There wouldn't be a discount at that point.
Okay, wonderful. And Nick, how do members go ahead and sign up for that Peloton membership? Do they sign directly through Peloton, or do they need to go to the Myuhc portal?
Yeah, so that's a great question. All of our programs, the best way to sign up for them is through the myuhc.com. Basically, that's how we verify that you are a UHC member and that these programs are available to you. So that's where you would want to go and log in and access all of those programs. And that includes OnePass, Apple Fitness, Raleigh, and Peloton.
Perfect. Thanks, Nick. Another one here, when comparing the individual only for the signature value HMO and the Harmony high deductible plan, which might be more cost effective when factoring in copays, deductibles, out-of-pocket maxes?
So that's a great question. But what I would say is it really depends on the individual. It depends on utilization and how you utilize your benefits. It's hard for us to say which one would be more cost effective because we don't know the utilization that a member would have on the plan. So you really just need to look at the benefits and see, maybe you use what you've in the past. How often have you gone to the doctors? Are you a high utilizer, somebody who goes to your doctor on a regular basis? And, based on the copays listed, that'll help you make that decision. That's probably the best way I can answer that, based on not knowing the specifics for an individual.
Yeah, and just so you're aware, I have gone ahead and backtracked to the slides because I do know that the high deductible health plan is a brand new plan offering for the county right here. So if you do have more questions, I have gone ahead and pulled the slide back up that shows a lot of the common out-of-pocket costs that are available as well. So I hope that answers that question. Can we re-show the acupuncture or access? Absolutely. So as Nick mentioned before, chiropractic and acupuncture services are covered at through Optum Health, and your copay is going to vary depending based on what your primary care physician copay is going to be. And so we have provided the website. I know it's the longest address that there is possible. One thing that I've done in the past is I've just Googled Optum Chiropractic or Optum Acupuncture, and more often than not, this site will pop up. And really, you can go ahead and do a search. You can do that search by zip code, your city, and you can find a list of in-network acupuncturists that are available to you. And so as long as you go there, you get unlimited visits based on medical necessity. We did go ahead and record this presentation, so we will go ahead and provide the presentation to the county, and I believe that the county will be posting that as well. Nick, this one, it looks like this one would be for you. Currently, I have the HMO Network 1 plan through Sharp and Radies. Does the Harmony high deductible health plan Sharp and UCSD mean that Radies is out of network if I choose to switch over?
Yes, Harmony, the Radies Medical Group is not currently offered underneath the Harmony network. Now, there are instances where UCSD and Sharp will refer members out to Radies for specialist visits and certain cases, but to have a specific pediatrician through Radies, they are not available for assignment on the Harmony network.
So just to reemphasize, we just want to let you know that if you are currently enrolled into the HMO Network 1 plan, you do have access to Sharp Steely, Sharp Community, and Radies Children's. If you do switch to the Harmony high deductible plan, Radies Children's is not available. It's not a medical group that is tied to that plan. However, you do get access to UCSD. However, you could potentially be referred out by your primary care physician to seek care through Rady's if needed. Correct, Nick?
Yes, that is correct.
Thank you. Nick, do you know if the Network One offers any type of speech therapy?
Yeah, so speech therapy is an available benefit underneath, I believe, all of the plans. It's based on medical necessity, so they will need to speak with their primary care physician in order to give referrals, but it is an available benefit, yes.
Can you estimate what a normal office visit would be as an example? Nick, I'm going to have you help me with this one, but really with the high deductible health care plan, and I assume that's the plan that we're discussing here, is let's go back to what the plan out-of-pocket cost is for this one. So right now, your deductible is $2,700 as an individual, meaning, let's say you go to the doctor's office, your first visit is $500 for that service. Well, that is below your deductible amount. So you would be responsible for that $500 until you've reached that $2,700 for that visit, or for the visits that you've acquired throughout that plan year. Once you've received that $2,700, so once you're responsible for paying 100% of whatever costs that you incur up to that $2,700. After you've reached the $2,700, then basically you're only responsible for 10% of whatever services you have after that. So if you reach that $2,700, and let's say your next visit is $1,000, for instance, you would only be responsible for paying $100, and then the plan would pay $900 of that until you reach that out-of-pocket maximum. So you're always protected by that out-of-pocket maximum, which is $3,000. So if I'm an individual on the plan, I've met my deductible at $2,700, I've paid and I get to $3,000 for a given plan year, then I am responsible for none of the costs after that. Basically, then at that point, then the plan would cover it 100%. Nick, am I missing anything there? Is there anything that you would like to add on for that?
Yeah, the one thing I would add on, because it seems that there's a question specific about, your regular PCP visits. So preventative care still falls under 100% coverage. So preventative care will be the exception to the deductible in this case. So when you're going to your PCP for those basic visits or checkups, those will still be covered at that 100% amount. The deductible won't kick in for those particular visits. It's all of the other services that you may go to your PCP for, where the deductible would apply prior to the plan picking up any amount.
That's a great point, Nick. I'm glad you brought that up. Thank you. I hope that answers that question. So for the Harmony High Deductible plan, to clarify, it's a 10% copay after the deductible is met up to $3,000 out-of-pocket max. Yes, that is correct. Once you've hit that $3,000 in a given plan year as an individual, then the plan will pay at 100% after that.
And that's for the individual.
That's correct. Yes. If you have more than one person on the plan that's covered under the plan, then your out-of-pocket max would be $6,000. Great point. Thank you, Nick.
Of course.
With the high deductible plan, there are out-of-pocket costs for preventative care services prior to reaching that deductible. Nick, I believe that you answered that quite nicely. Preventative care is covered at 100%. Are there any circumstances where they would go in for preventative care? If they end up finding something, then they would be responsible for the payment at that point, Nick?
If there are follow-up services, there's potential, but the initial preventative care visit and services received, that would be covered. It'd be a little situational after that, depending on what's received, so it'd be hard to say. But again, but that's the case in general for all preventative care. Anything after that becomes diagnostic, and there could be coverage. I mean, could be copays, but again, that's the case for all preventative care in general, not just the high deductible health plan.
Fantastic. Thanks, Nick. Does the Carum Health surgery benefit only cover those services recommended by them? So the 4 services are orthopedics procedures, spinal procedures, coronary artery bypass graft, and bariatric surgery. Those are the only 4 covered services that Carum will cover. Let's go ahead and take a look. So okay, so Nick, maybe you can kind of help explain this too. He goes, I do understand 100% deductible up to $2,700, but $100 versus $500 for an office visit, an MRI, an X-ray, not necessarily your yearly checkup. So you're not going in for preventative care. Could be a massive difference and influences whether or not I would choose that high deductible plan versus one of the other plans. So basically what they're simply saying is the cost can vary for the time of service. And is there a way that they can go ahead and take a look at what those estimated costs could be at the time of service for that plan?
So, and it's a great question. I understand what they're trying to ask. So the reason why it varies is because there's when processing claims, they're processed using what we call usual or customary rates, but those can vary by medical group. So according to contracts with said medical groups. So unfortunately, that's where I say that there can be varied costs for specific types of services, and why I'm not able to provide specific amounts on for something like a PCP visit. Even when it comes to an MRI or an X-ray, they're both different types of scans. There'll be different copays for those types of scans. So that's where it gets tricky, and we can't provide specific amounts. They ask for the website again. So again, the cost estimator can be found on myuhc.com. But I do want to say again, it's an estimator. It will vary. It'll give you a rough amount of what you can possibly expect for something, but it's not a set amount. You can't specifically expect to see that as a copay on a claim. So I just want to premise that, because I don't want somebody to go in expecting that be the specific amount, and it's not the case. I hope that helps. I know doesn't give the exact answer when they're trying to make this decision, but that's a little bit of understanding of why I'm not able to provide the specific amount or per service that they're looking for.
Understood. And just to reiterate, we want to let you know that there are different types of HMO offerings. It's not just tied to this one plan. So maybe if one plan doesn't suit you, you may want to take a look at the out-of-pocket costs on another plan. So on the other plans like the Alliance plan or the Network One plan, you're going to pay one flat copay at the time of service for those services being rendered. So, you know, with the high deductible health plan, although we can't tell you what the exact amount for that service is going to be, you know, if for like one of the other plans like the Alliance or the HMO Network One, you know, if you go to see your doctor, you're going to pay one flat copay. So for the Alliance plan, you're going to pay $25. For the Network One plan, you're also going to pay, it's a $25 flat copay. So flat copay. So you'll pay the same amount every single time that you go see your primary care physician doctor, with the exception, as Nick mentioned, for preventative care, that is always covered at 100% across the board with all the HMO plans. So I hope that helps kind of determine. You may want to take a look at the different plan offerings and what the out-of-pocket costs are, and that might help determine the type of plan that you want to enroll in. And I believe that the benefits department can always, you can always reach out to your benefits department for further clarification as well. One last question that I have so far here is, if we want a specific doctor for those surgeries covered by CAREM, will they still cover it at full cost? I guess it just depends on if the doctor that you're looking to have that specific surgery, if CAREM can recommend that specific doctor. Really what they're going to do is they're going to go through a consultation. They're going to tell you about, you know, the best doctors for the best type of treatment. So what they will do is, let's say you need to have knee surgery. Well, they're going to take a look and see, you know, who's the best surgeon for those knee surgeries. They're going to make a recommendation of who you would like, who you can have that surgery benefit through. And if you decide to use them, they're going to cover 100% of all the costs that are available to it. Now, if the doctor that you're looking to utilize that they don't is not someone that covers it, that falls under CAREM, then you would just pay whatever your normal out-of-pocket costs would be for that surgery benefit. So my best advice for you is, if you are planning to hospitalization, I would just give CAREM a call, let them know your situation, and then just let them discuss with you. And then at that time, you know, they can always answer any questions, you know, about a specific doctor or anything like that, if that falls under the benefit, or if it falls under their concierge service. At this time, it doesn't look like I have any more open questions. If you do have any more open questions, please feel free to type them into the chat. We are more than happy to stay on and answer any questions that you guys have. What does the out-of-pocket limit mean? Nick, would this be something that you would like to talk about?
Yeah, so the out-of-pocket limit is basically the maximum amount you will be responsible to pay before the plan will pay 100%. So in the case of the individual only plan, for instance, your out-of-pocket limit is $3,000. So once you have paid $3,000 out of pocket for services, medical services received on the plan, the plan or UHC will then pick up 100% of all services after that. All covered services, I will say. So that's a little bit of explanation on what the out-of-pocket means.
Thank you, Nick.
Mm-hmm.
Still not seeing any additional questions. Again, if you do have any questions, please feel free to type them into the chat. We're more than happy to answer. Here's a question that we received, Nick. I've never had a high deductible health plan. What are some key things that I should know about? It's a great question.
Yeah, so there's the key things are kind of the things what we've talked about, to understand that the deductible, on each plan will either be individual is $2,700, family is $3,000. You as a member will be responsible of satisfying that deductible prior to the plan picking up any amount on there. So those are probably the biggest key that I would call out of understanding what a high deductible health plan is. And again, you'll notice, like we just talked about, especially on the individual plan, or even in family plan, once you've satisfied that deductible, that applies in full to the out-of-pocket limit. So for instance, on the individual plan, once you satisfy the $2,700, you only have $300 of copayment that you will be responsible for before you meet the out-of-pocket limit. And again, once you reach the out-of-pocket limit, the plan will pick up 100% of coverage after that. So that's a key thing to consider and note there. And again, this applies to your RX copays. I don't want that to be forgotten about. These are your ESI RX copays. So when any copay you pay for any medication, those will be applied to your deductible as well. They're completely included included in your deductible and your out-of-pocket limit, just so there's no confusion with that.
And the deductibles reset each calendar year, correct?
Correct. Great call out. Thank you. Yes, they do reset based on calendar year. So, once so for instance, it starts on 1/1/23 for the new year. Come 12/31/23, they would reset for the new plan year.
And really, as an individual, you want to take a look at the out-of-pocket costs that you're going to be paying at the time of service. If you are someone who likes to just have a flat copay at the time of service, you're used to paying X amount of dollars every single time that you go to the doctor's office. The high deductible health plan may not be the best plan for you, so you may want to consider possibly one of the other plans. However, if you're someone that goes to the office or goes to your doctor's, maybe you go once or twice a year for your preventative care checkup, maybe you go once a year for like a common flu, this could be a plan that could be very beneficial for you as well. So it's really just comparing those out-of-pocket costs to find out really what works best for each individual. Who would we contact if we had any prescription questions? Great question. So your pharmacy benefit manager is going to be through Express Scripts, whether you're either on the any of the UnitedHealthcare HMO plans or you're on the UMR PPO plan. All of your prescription drug coverage is going to be through Express Scripts. If members have any questions, they can always contact Express Scripts directly. However, again, I did provide that advocacy number in case there's any challenges that anybody's having, or if there's any questions about a specific type of drug that's being covered or not as well. Great questions that are coming in here. I'm not seeing any additional ones at this time. So if you do, please feel free to share any questions that you have. We are more than happy to answer them. I am not seeing any additional questions coming through. Nedra, was there anything else that you would like to add before maybe we wrap up?
I believe a lot of the questions were answered perfectly, and we had a good flow of them. I don't have anything else, but I do see a couple more just came in.
Yep, I do see that as well. We'll go ahead and answer those as well. Let's see. Would I pay a copay under the high deductible health plan and then receive a bill for the rest of the payment later? Nick, is that something that you can help answer here?
That's a great question. I do not believe you would be, there wouldn't be a copay necessarily that you would pay, because again, it's once you meet the deductible, trying to see how to word this. Once you're responsible for the full amount until you hit your deductible. At that point, they would, sorry, I'm trying to go through this.
So Nick, I mean, I think what was being asked is, I'm an individual, I'm about to go see my doctor. And I go and I see my doctor. It's not for a preventative care reason, so it's not covered at 100%. So at that point, they would be billed a fee for service. They're not paying a flat copay at the time that they go and see that doctor. They're going to receive a bill from the doctor's office. Is that correct?
They will receive a bill, but there's potential that the doctor may ask for a certain amount. That would vary. But yes, they will receive a full bill for the service, because there's not a set amount until the claim is submitted to UnitedHealthcare and processed. So that's, yeah, so they would have to, the doctor's office would then have to submit a bill to UnitedHealthcare. The claim would be processed, and then they would send out a bill to the member. So in most cases, yes, typically they should not receive or be asked for a copay at the time of service, because there has been no claim submitted and processed to UnitedHealthcare.
Okay, and then usually how long does it take for an individual to receive a bill once they've actually received that service?
It would vary depending on the processing of the claim when it was submitted. I don't have an exact timeline because it can vary. But once it's submitted to UnitedHealthcare, it typically takes around 30 days for the claim to be processed. At that point, the provider will be notified, and then a bill would be sent out.
Okay. Let's see. It looks like we have an individual that actually tried to go onto the site and check out the cost estimator, but it does look like you have to be a member of UnitedHealthcare in order to go ahead and access that. Is that something that you can estimate before you actually sign up to be on the plan? Is that a possibility? That's a great question.
That is a great question, and I apologize. I didn't realize that you needed to be a member in order to utilize that. As of now, that's the only cost estimator tool that I am aware of, but I will take it as a takeaway to see if there are any other options that I can recommend. But as of now, I do not.
Thank you, Nick. These are great questions that are coming in. Really appreciate it. Feel free to ask as many as you would like. Not seeing any additional questions so far.
Matt, in response to the individual who asked a question about the cost estimator and needing to be a member to do that, I actually Googled and I found a calculator estimator through looks like Excelis. I can put it in the comments and hopefully this will help the employee put in their calculations and get a bounce back with numbers. So I'll do that right now.
Oh, okay. Fantastic. Thank you so much.
Sure.
Also want to make mention that, we understand that the high deductible health plan is a brand new plan for the county. And so there are going to be a lot of questions surrounding this plan, as it is a little bit different type of plan from your traditional HMO copay plans. So again, I just want to remind you that if you have a lot more of these questions, you can always reach out to our VEBA Advocacy Department. Again, they are more than happy to help. I'm going to go ahead and put their contact information as well, and they're really familiar with helping and answer these type of questions as well, with regards to these kind of costs that you could be responsible for. And they are always standing by, willing to help with this. So we do know that when you're transitioning to a new provider, that there could be a lot of costs or what those questions could be. So again, the Advocacy Department, they are available Monday through Friday from 8 a.m. to 5 p.m. So you can always reach out to them. They'll be more than happy to help you if you are thinking about switching, from one of the other plans that you may be currently enrolled in to what plan you may be thinking about doing. So we do understand that there are a lot of questions around that high deductible plan. They are aware and are absolutely very great and helpful at answering any of those additional questions you have. Nick, I don't know if this is something that you can maybe take back to your team, but maybe folks, if there's a way to get kind of like a test account or a way to do some sort of a general cost estimator for specific types of services without actually having to sign in to myuhc.com, just a takeaway possibly.
Yeah, absolutely. Again, I wasn't aware. I didn't realize that it was members only. I agree. I think it makes sense to have something like that out there. So I'll pass it along, and hopefully we can change that in the future.
Yeah, I think that's a great recommendation. We can definitely look into that further. It looks like Nedra, you went ahead and put that into the chat. So hopefully that individual can see that question, or to be able to see that as well. So thank you so much for doing that.
Absolutely, my pleasure. And in the event anyone else misses that link, feel free to contact the Benefits Division, and we'd be happy to share that information and enlighten on some of those concerns as well.
Hey, Matt, Margie actually just reminded me on the side via a great reminder that members can always reach out to our customer service team directly as well. And they have access to pull up that information and kind of put in general information or cost estimates and utilize that tool to help the member out. So please, if the website that was provided to you doesn't work, please reach out to our customer service team, and they will help you get that answer.
Fantastic, great. Thank you for bringing that up, Margie.
You're welcome. I always get those questions too.
Little different plan design, so yeah, absolutely.
Yes, so true.
See, we have just a few people left here in the meeting. If you have any questions, please feel free to reach out.
Well, Matt, Margie, and Nick, I see no more questions coming through. I believe we can resume the webinar. And if anybody thinks of anything afterwards, they can always contact you all or myself and benefits.
Absolutely, Nedra. And, you know, on behalf of Margie, Nick, and myself, we would really like to thank the county for the opportunity to be able to be here today and present on these benefits. You know, I know we're doing multiple meetings, so if anyone missed anything in the first meeting, we're happy, you know, we have 2 more that we're happy to present at. So thank you guys so much for allowing us to be here today. We really do appreciate it, and happy to answer any questions that come through on your end that we can help support.
Great. And thank you. Thanks again, everyone, for joining us, and have a great rest of the day.
Thank you, everybody.
Thank you. Bye-bye.
Thank you.